I would like to talk to you today about anal and vaginal stricture or tightness, which is a debilitating disorder that affects both children and adults, not just in the UK but across the world. It can be caused by Crohn's disease, colitis, anal or vaginal strictures, scar tissue due to radiotherapy and many other disorders. It causes discomfort, pain, difficulty with passing waste and difficulties with intimacy. The NHS currently uses Hagar dilators, which are fit for purpose. However, we've identified that a number of clinical and financial issues with these. Clinically, Hagar dilators are not disposable and are reused between patients, therefore there is a risk of cross-contamination. Also, patients find them large, clunky and uncomfortable. From a financial perspective, Hagar dilators have to be autoclaved to ensure the dilator is completely clean before being used on a new patient. This can be a long and costly process. Hi, my name's Caroline Sanders and I'm a practicing children's nurse. I'm currently working with a team of gynecologists, urologists and paediatric surgeons to develop and design a new dilator, which we're calling the ExiStretch. We believe that it overcomes the clinical and financial shortcomings of the existing products on the market.
Hi, I'm Jenny Shimin. I've been dealing with problems like this for a while. I co-found a charity called Diversions for children with bladder and bowel diversions and dysfunctions. Diversions is a support group for families of children with bladder and bowel diversions and dysfunctions. So they've either been born with a congenital abnormality or diagnosed with a disease, which has resulted in surgery of the bladder or bowel. We do outdoor activity days, camping trips, art days, anything that will bring the families together so that they can sort of meet and talk about their experiences in a setting where everybody else understands. Kids with these kind of problems, they face isolation, embarrassment. They kind of feel very different to the other children that they come into contact with. At the moment, for anything that involves some form of dilation, Hagar dilators are probably the #1 option by surgeons and nurses. As for other options, surgery is probably the closest. So the ExiStretch would basically give another option that's a lot easier, a lot more child and adult friendly, and doesn't look as sort of clinical and scary.
We are developing reusable and disposable version, which come individually packaged or as a set ranging from size 7 to 14mm. The reusable ExiStretch is a discreet single patient use dilator which the family or the individual takes home, where it can be washed and then reused. From a clinical perspective, this reduces the risk of cross-contamination as each patient is given the dilator they need for use at home, which they then dispose of at the end of their treatment.
So basically, I was diagnosed with Crohn's disease when I was 12. I was fine for a while, and then it got worse and worse, and I ended up with stenosis of the bowel, which was quite bad. My only option was either surgery to have it removed, strictureplasty, which wasn't really possible because of the position of the stricture. So Hagar dilators were the only option. At the time, I was having it done in theatre every 2 weeks for about a year, and they gave me the option of trying it myself at home, which resulted in a bit of a nightmare, to be honest, because of sort of the shape and style of them, and having to do it by yourself is very, very difficult because of the weight and the shape. So obviously any other option would have been welcomed at the time. So the ExiStretch is a lot lighter, aesthetically a lot less scary and clinical, and a lot easier to get hold of. My main issue was that I only needed one specific size at one specific time, and the hospital was struggling to get hold of just a single Hagar dilator. I was basically having to take them out of surgical kits, and obviously at a hospital where it's limited anyway, it was very difficult. And my other option was to buy a full set for myself, which I didn't need because it would have been a waste. So obviously being able to get hold of the ExiStretches in separate sizes and buying them as a single unit is a lot easier as well. I think just as a whole, the ExiStretch for parents and children trying to explain to a child what you're going to do to them and then showing them some horrific surgical tool is quite scary, whereas they don't look as horrifying, they don't look as scary. And I do think that children will adapt a lot better to using them and also maybe using them themselves when they're a little older.
The disposable dilators are for single use, with infants, children and adults, used by clinical staff in hospitals. It's made from PCL, a biodegradable material that has been approved by the American Food and Drug Administration for medical use. From a clinical perspective, we have chosen to make the disposable Exi-Stretch out of PCL, as it will melt to a putty-like consistency if washed in hot water, making the dilator unusable. This means that once the dilators have been used, they have to be thrown away, eliminating the risk of cross-contamination. Both of our dilators are light, easy to use, comfortable, non-toxic, biodegradable and environmentally friendly. We also believe our dilators will offer you better value for money.